Welcome to Module 15 of our HIV and AIDS course. In this section, we're going to focus on overdose recognition and naloxone awareness. And this is a really important topic for addiction counselors because overdose deaths continue to affect individuals and families and communities across our country. And we're going to experience clients who are actively using substances. We're going to experience people in early recovery or who are relapsing after a period of abstinence or who are combining multiple substances. And we're also going to experience people who are undermining or underestimating the potency of the substances that they're using. So we want to understand what overdose looks like and how overdose develops and what warning signs come up. And we also want to look at how to respond appropriately while staying within that professional scope of practice. So we're going to discuss opioid warning signs, overdose signs, stimulant-related emergencies. We're going to talk about fentanyl concerns and the basics of naloxone and how we're supposed to respond. And one important thing to remember here is that overdoses don't always look dramatic or obvious at first. Some people may simply just appear asleep or intoxicated or difficult to wake before the situation becomes life-threatening. So recognizing the warning signs early can save lives. So an overdose is when the body is overwhelmed by the effects of a substance or a combination of substances. And different substances are going to affect the body differently, but overdoses can generally interfere with bodily functions. So we're going to look for difficulty breathing, heart functioning, consciousness of the client, nervous system regulation. And some overdoses are going to involve dangerously slowing the body down, while others are going to involve overstimulation. And so opioid overdoses are going to slow the breathing to a dangerous level. Stimulant-related emergencies may involve heart problems, overheating. The client may become agitated or start having seizures or even like cardiovascular collapse. And then we know that overdoses can range from mild to fatal, and sometimes those symptoms are going to escalate rapidly. And so one challenge in behavioral health settings is that the clinician may think that the client just appears intoxicated initially, and then that causes other people to underestimate the seriousness of that situation. So we definitely don't need to minimize symptoms or assume that somebody's just going to simply just sleep it off. When the breathing or the consciousness becomes impaired, the situation needs to be treated seriously. So several factors have contributed to increasing overdose risk in the last few years, and one major factor is fentanyl. And fentanyl is a synthetic opioid that's significantly more potent than heroin or many prescription opioids. And in a lot of areas, fentanyl is mixed into other substances and sometimes without the other person's knowledge. And that creates an extremely high overdose risk because people may unknowingly consume far stronger substances than expected. And then there's carfentanil and iso, any of the nitazines that are out there. So they're becoming potentially more and more potent. And then polysubstance use is going to increase risk. And that's going to be combining the opioids with alcohol or benzodiazepines or any sedating substance. And that dangerously suppresses the breathing. Another factor is relapse after a period of abstinence. When a person stops using whatever their drug of choice is for a period of time, their tolerance is going to decrease. And if relapse happens and they go back to using at their previous dose levels, overdose risk is increased significantly because the body can't handle that same amount safely anymore. And so we need to recognize the overdose risk affects a lot of populations, not only people with severe long-term addiction histories. So opioid overdoses are often going to involve respiratory depression. That means the breathing is slowed dangerously or it stops altogether. So we need to look for very slow breathing, shallow breathing, inability to wake the person up. Their skin is turning blue or gray, and their lips or their fingertips. pinpoint pupils, so their pupils are very, very small. Their body posture is limp, or they're making unusual choking or gurgling sounds. Some people describe that gurgling as kind of a death rattle, and this may indicate that there's airway obstruction or severely impaired breathing. And when someone's experiencing opioid overdose, they may appear deeply asleep at first, but attempts to wake them may fail on our part. So we need to pay attention to, are they responsive? What are their breathing patterns? What is their skin coloration? What's their overall physical condition? These symptoms can worsen pretty quickly. So if they're breathing slowly, they can stop breathing entirely within minutes. So prompt action is going to be required. Stimulant-related emergencies can look a lot different than opioid overdoses. So we're looking at methamphetamines, cocaine, and other stimulants. Those are going to increase the activity in the nervous system. So we're looking for chest pain, rapid heart rate, severe agitation, paranoia, confusion, overheating, tremors, seizures, all of these things. People might appear restless or aggressive. They may start to panic or be emotionally unstable. Or maybe they suddenly collapse because they're having cardiac complications or severe physical stress. So stimulant emergencies can become dangerous pretty quickly, especially when they're combined with dehydration or heat exposure or any underlying health conditions. So we need to avoid escalating the situation emotionally, and just seek emergency assistance when the person appears unstable or the symptoms start to become severe. Now, naloxone is a medication that's used to reverse opioid overdoses temporarily. And that's the key here, is temporarily. It's to get them to the hospital, basically. It works by blocking the opioid effects in the body and then restoring breathing in a lot of overdose situations. It's really important to understand that naloxone only works on opioids. It doesn't reverse stimulant overdoses, alcohol intoxication, or any other non-opioid medical emergencies. So xylazine or cocaine or methamphetamines, it's not going to work on those. But because fentanyl contamination is common, naloxone may still be appropriate in situations where opioid involvement is suspected. So naloxone is considered an emergency intervention, not a cure. And even after naloxone is administered, emergency medical evaluation is still going to be important because overdose symptoms can return after the medication wears off, and it doesn't last very long. So we need to understand basic naloxone awareness, even if we're not directly administering it in our workplace role. And if you suspect an overdose, the first priority is remain calm and respond quickly. We want to check responsiveness, observe their breathing, contact emergency services, and follow your workplace procedures. If naloxone is available and the counselor is trained and authorized to use it according to workplace policy and local laws, then it may be administered during a suspected overdose situation with opioids. But we need to stay within our training and our professional role. Even if naloxone is administered successfully, emergency medical services should still respond. Because people who regain consciousness after naloxone, they feel confused and disoriented, they're agitated, they're frightened, and they are physically uncomfortable because you have immediately stopped their high and the pain just comes. So just remain calm. One major barrier during overdose situations is going to be fear. Some people hesitate to call for help because they fear that they're going to be arrested or legal consequences or judgment or involvement from the authorities. Other people may panic and leave the scene instead of seeking emergency assistance. Stigma surrounding the substance use is going to contribute to delayed emergency responses and an increase in overdose deaths. So just recognize that compassionate, non-judgmental responses are going to improve safety. During an emergency, the priority is preserving life, not shaming people for their substance use. And people who are experiencing overdoses are already medically vulnerable, and they may feel significant shame afterwards. So professionalism and emotional steadiness are going to matter greatly during crisis situations. So counselors need to remain aware of professional boundaries during overdose situations, recognize the warning signs, activate the emergency response system, maintain safety, and, provide support within your training. You're not supposed to do any advanced medical procedures, diagnose any medical conditions, or act outside of your level of competence. Knowing when to involve the emergency responders is an important part of our ethical practice. Overdose emergencies can affect us as clinicians as well. We're going to experience, a range of emotions like anger, guilt, anxiety, exhaustion, sadness, whatever. And we may start replaying that event over and over in our head afterwards. And this is normal. Ignoring stress is going to contribute to burnout. So, like I said before, seek supervision, get support, and consultation when you need after these intense emergencies. Prevention and education are always going to be important parts of our overdose response work. So, we can help to reduce overdose risk by discussing relapse risks with our clients and engaging treatment or encouraging them to engage in treatment. We want to promote healthcare access and support harm reduction efforts. And we also want to reduce the stigma around addiction and overdose. So our clients, they need factual, respectful conversations rather than fear-based lectures or shame. A lot of overdose deaths are preventable when people have access to education and resources and emotional support, and they get timely intervention. So as we're closing this module, just remember that overdose situations require calm, professional, and timely responses. We don't have to be medical emergency experts, but we should understand what are the overdose warning signs, how to respond in these emergencies, have a little bit of knowledge of Naloxone and how to administer it, and stay calm and safety focused. Overdose prevention and response are important parts of our behavioral health work because addiction and medical vulnerability are often very closely connected. So in the next module, we're going to discuss additional first aid situations like seizures, diabetic emergencies, shock, and other medical concerns that counselors may encounter in their behavioral health settings. So when you're ready, proceed to module 16.